It's the extended broadcast on COVID-19, and I am Samson Kasumba. With limited supply of vaccines, hardly any innovation on new medicine, and limited ways of checking the effects of COVID-19 on the population here, the community has been tasked to engage in observing standard operating procedures, and those have since sort of, I think, gone haywire. Just a few days, the lockdown has been eased by President Yoweri Museveni. He normally eases those, and standard operating procedures, at least the management of them, is a task that was given to the Uganda Police Force. The Uganda Police Force is now saying that we are behaving like we've never heard of standard operating procedures. Now, we are joined by Dr. Josephine Okwera, Director, Health and Social Services, Uganda Red Cross Society here in the country, and they have been engaged in implementing community engagement strategy for COVID-19 since October last year. And Dr. Josephine Okwera is certainly here with us. Let's have a conversation. Doc, thank you so much for joining us. What have you observed as the Red Cross Society in as far as getting us into standard operating procedures is concerned?
Thank you so much, Samson, for having me, and good evening, viewers. As Uganda Red Cross Society, we have done quite a lot working alongside government and specifically the Ministry of Health in making sure that we support the establishment of structures at community level to be able to support the relaying of messages at community level and being able to effectively engage with communities, not only in providing information, but being there for communities to ask questions and get responses and clarifications on a number of issues where they have myths and misconceptions. We have a team at community level that is able to listen to the community, and that is what effective community engagement would mean: listening to the communities and being able to address their questions, their concerns, but also using community members themselves to be able to reach out to fellow community members in relaying the information. So we have a team that is formed, that is the Community Village COVID Task Forces, as was highlighted in the Community Engagement Strategy, which was launched in October of last year. So with this, we work to form the Village COVID Task Force at community level, and we have done this in Kampala, working together with Ministry of Health, KCCA, and the different division task forces within Kampala, then the district task forces in Mukono as well, and Wakiso, plus other districts outside the Kampala metropolitan area where Uganda Red Cross is supporting.
Task forces, how effective are they, and what are the challenges, if any, that they are experiencing?
So the beauty we see with this is that because they are right at the grassroots levels, they are engaging more closely with the communities that they better understand, because some of the members of this Village COVID Task Force are the people in the community themselves. Like we have the LC1, we have the VHTs, we have religious leaders, cultural leaders, and other implementing partners who are based within those communities. And of course, the Red Cross volunteers working alongside. So that is the advantage that we have. There are people who are familiar with that context. And some of the challenges we find is that, as we all know, observation of the SOPs is really a behavior change, which is a process and it takes time, and there are many factors really that influence a behavioral change. So it's not only about providing the information that would make people change their habits or their practices, but it has more to do with what people have available as resources within their context, social context and economic context as well. Because you might be talking of washing hands regularly with soap and running water, and many people might not be having the soap and the running water really to do the washing like we would be teaching them to do. But you have to look within that community context what is feasible. And this is what the Village COVID Task Force team would be there to support the communities and go beyond the prescriptive message and look and say what is applicable within our context. So we have innovations that were long used within rural contexts that is really helpful in certain contexts, like where there's no tap and running water, you can use the tippy taps to ensure that you wash your hands regularly.
Now, we do know that we don't want Uganda to lose the fight against limiting transmission of COVID-19. What is Red Cross Society doing with that, and if you may briefly?
So like I already said before, the focus is really at community level and making sure we engage with the community. It is effective engagement because you have people there on the ground to provide messages on do the risk communication, do community-based surveillance, and then also be able to provide home-based care and mobilize people to take on the vaccines. Now we know Ministry of Health took on that approach of home-based care for people with mild symptoms or people who are symptomatic. So when they're in the community, we need a team that is able to follow up these people, provide the support that they need, and to be able to monitor how they are progressing with their medication. And if there is need to be transferred to the health facility, then there are people who can link them up to the health services. So our teams, as the Red Cross, the volunteers are there working integrated in the village COVID task forces, doing that supportive role, providing the information, doing the community-based surveillance, doing the home-based care, and then also educating and mobilizing communities to access the vaccine.
Dr. Okwera, thank you so much for speaking to us. It's certainly been a very educative one. I can tell you that if you can't understand why you should wear a mask consistently or wash your hands consistently, then you can never understand what convalescent plasma is and how it is beneficial in the management of COVID-19 and why that study failed. This one was less confusing than the first one. But something not confusing is what I mean, is that we have a bulletin.